When chronic nephritis occurs, the kidney develops a pathological phenomenon of glomerular necrosis or obstruction of the renal tubules. Western medicine treatment of chronic nephritis is to do everything possible to restore necrotic glomeruli, or to clear blocked renal tubules. Finally, kidney dialysis is required, followed by kidney transplantation. But long-term clinical trials have proved that this method is impossible to take effect. Western medicine also restricts the protein intake of patients with nephritis, which is very wrong. Because the consequence of restricting protein intake is kidney atrophy. Why does Western medicine restrict the patient's protein intake? Because there is protein in the urine, Western medicine believes that the kidneys of patients with nephritis can no longer retain protein. That is to say, it is useless for patients to take protein. But according to this logic, people who have lost blood cannot have blood transfusions, and people who are short of water cannot drink water. In fact, only 1/3 of the units of a kidney usually work, and 2/3 of the units are in a dormant state. After the patient takes protein, the protein in the urine will decrease. That is to say, after the kidney is strong, it starts to work again. Unfortunately, it is difficult to treat patients who have had kidney atrophy or have undergone kidney transplantation. Chinese medicine believes that the cause of chronic nephritis. The objective reason is the deficiency of spleen yang and internal heat. The predisposing condition is chronic poisoning. Many people know that chemical fertilizers and pesticides are harmful, but they don't know that chemical additives are more toxic. Such as chemical colors, chemical flavors, chemical thickeners, chemical preservatives, chemical vitamins, artificial oils, salad oils, chemical beverages, chemical seasonings, chemical disinfectants. Most medicines are toxic, whether it is traditional Chinese medicine or Western medicine. Morphine can indeed relieve pain, but long-term use can endanger life. Corticosteroids can indeed reduce fever, but long-term use will cause tendon rupture. Alcohol is the enemy of mankind, cooking wine commonly used in Chinese cuisine, and liquor core chocolate that Western children love to eat. Long-term smoking can lead to lung cancer, long-term drinking can lead to cirrhosis of the liver, and long-term consumption of a large amount of salt can lead to coronary heart disease. These diseases are extremely difficult to treat. Patients with nephritis cannot eat seafood, because seafood contains a lot of heavy metals, and metal ions can damage the kidneys. Nephritis heating should promote the occurrence of uremia. Do not use diathermy. How to find nephritis early? The foam when urinating for the first time in the morning. Normal urine is not foamy. For people with poor kidney function, urine is like soapy water with a lot of foam. Secondly, if the urine output in 24 hours is less than 500 ml, then you have to go to the hospital for an examination. Kidney stones. Many soldiers died on the battlefield, no external injuries could be found, and the internal organs were broken, which is a blast injury. Shockwave crushes kidney stones? Shock waves can also cause blast injuries. Why do kidney stones occur? It is because the composition of urine is abnormal. Many Western medicines can change the composition of urine, such as vitamin D, calcium, and so on. In addition, there are some dietary factors. The fundamental problem of kidney stones is that there is too little drinking water, which results in too little urine output to flush out an abnormal component in the urine. What to do? Each person should drink no less than 1,500 ml of water per day. Sweat, diarrhea, and drink more water. The kidneys produce urine irregularly. Stones can be washed away by a large amount of urine. Why do you need surgery to remove stones? Rice vinegar can prevent stones, but rice vinegar can harm teeth. In fact, Chinese medicine discovered as early as 1475 that drinking fruit juice can eliminate all stones in the human body. Drink at least 500 ml of water every day when you get up. Drink 500 ml of juice before 3 meals a day. Then drink 500 ml of water every 2 hours, and drink 3-4 liters of water every day. Public toilets are a very important resource. Being Chinese is really happy because the government has built a lot of people's livelihood projects. I saw a piece of news saying that public toilets were closed because medicine confirmed that the virus could be spread through feces. Cardiomyopathies. Cardiomyopathy is a common dangerous disease. Often, when there are no conscious symptoms, the patient dies suddenly during strenuous exercise, and the physical examination before death is normal. This is the reason why many athletes on the competition field and many students on the examination field suddenly died. Patients who are diagnosed often die because they cannot strictly follow the instructions of the doctor. But most of the deaths were due to treatment by Western medicine, especially heart transplants. Western medicine only adopts treatment methods for symptoms, and its treatment methods all revolve around the heart, without considering the kidneys. To solve the edema of cardiomyopathy, it is necessary to rely on the kidneys instead of the heart, but there are not many Western doctors who value the kidneys.